Greetings and welcome. Welcome to the Cancer Conversations here on Scarlet Studios YouTube channel. My name is Rumbidzai with an AI, and we are going to be focusing on Chiedza Lydia Matinanga's journey. We are in the month of October, Pink October, Breast Cancer Awareness Month. Breast cancer is the second most common cancer among women in Zimbabwe. Joining us today is Dr. Pimba. Doctor, how are you doing?
I'm good. How are you doing?
Great. I want us to have a conversation
Okay.
Yes, tell us about yourself.
All right. So, as you said, I'm Dr. Patience Mba. I'm a clinical oncologist. That means that I'm a cancer specialist, and every day I wake up to take care of patients who have cancer.
Okay. So we are in the month of October. This is breast cancer. What does this month mean to you as an oncologist?
So, to me, this is a very important month on the calendar. It's one of those months where every day, anytime you're geared up to talk about breast cancer. This is a real challenge. It's a real problem worldwide. The commonest cancer amongst women, and it's the second most common in Zimbabwe. So I think it deserves all the attention.
Tell us more about breast cancer. What is breast cancer? When someone says, I have breast cancer, what does that mean?
So breast cancer refers to an abnormal proliferation of growth that has started in the breast, which is the ability to invade the surrounding tissues, spread to distant organs, and might eventually kill the patient or the host. So with breast cancer, it's not just one disease entity. We've got different types of breast cancers depending on the histological subtype, also the grade and the stage.
So, in Zimbabwe, let's say I've been diagnosed with breast cancer.
Yes.
How do I go about it? What do I do if I have breast cancer? Because according to research, we have women that are struggling with breast cancer silently because they're not getting access to oncocare.
Yes, to cancer care.
Yeah, cancer care. It's called cancer care.
Yeah.
Okay.
Or cancer treatment.
Okay.
Yeah. So in Zimbabwe, when you get diagnosed, you're often diagnosed at a peripheral hospital or peripheral clinic, meaning that it could be the nearest health center closest to your residence.
Okay.
Somebody picks up a breast lump, or you yourself pick up a breast lump. You go to the nearest clinic, and then a nurse or a doctor there will examine. Then they will probably tell you this is most likely an abnormal lump, or maybe you're breastfeeding, it's just an abscess. From that point on, you go for what's called a biopsy.
Okay.
So a biopsy is a small sample of tissue that's taken from the abnormal lump, sent to the lab. It is analyzed, and from then on we get confirmation whether it's actually cancer or it's benign, which is not cancer.
Not cancerous. Biopsy. How is the biopsy done? Is this a matter of being cut and they take tissue and then they test the tissue and then they tell you you have cancer or you don't have cancer?
So being cut, yes, you're cutting away, but it's not in that, it's no longer done in the way that it used to be done in the olden days where you'd really have a big wound. Nowadays, we encourage what's called a core biopsy. It's done by a big needle. So a needle just goes through the breast, targeting the exact lump, and then a core of it, or just part of that lump, is taken inside the needle. It comes out, and that's the sample that goes to the lab.
Okay.
However, we still have a few centers which don't have core needle biopsies, so they still do a bit of the opening and taking a small sample.
Okay. From biopsy, where do we go? I've been confirmed that I have cancer. What do I do after that?
So from biopsy, a patient goes back to their doctor, who then explains to them what the results are like. And we've confirmed cancer, we now go for staging. So staging is when we are assessing the whole body to check if this cancer is just in that breast that we found it, or it has spread to other organs. So with breast cancer particularly, it can go to the lymph nodes in the axilla, it can go to the neck, But then it can also go to other organs like the lungs, the liver, the bone, and even the brain for some patients.
Okay.
Yeah.
So after biopsy, I've gone to the doctor, I start treatment.
So you've gone to the doctor, you have staging. After staging, your doctor then sits down with you and then gives you the appropriate treatment depending on
the
your
stage. There are stage 1, stage 2,
stage 3 up to stage 4.
Yes. And then from there, chemotherapy, the most dreaded word in any conversation.
Okay.
Dreaded in terms of, they say that the patient goes through pain, and then they also say the cost of chemotherapy in Zimbabwe.
So I think chemotherapy is generally dreaded by most patients because of the side effects which most women will have when they're undergoing breast cancer treatment and they get chemo. So some women will get hair loss, or most women will get hair loss. There's nausea, vomiting, loss of appetite, can get fatigue. Some women will get a bit darker, so their skin complexion will be different, their nails will be different, and then the bone marrow tends to also get a bit suppressed. So you find that some women will not be prone to infections. So during chemo, the oncologist, we are busy telling our patients not to interact with too many people, to limit visitors, to eat well-cooked food, and to report any kind of infection that they get, be it a cough or diarrhea. So these are just some of the side effects that a patient might experience.
I've heard people say, oh, you know what, I actually know of a health official that got diagnosed with cancer, and breast cancer, and she was saying, I'm not going to go through chemotherapy because I know it's poison, so I'm going to go through the natural herbs. And I see there's an influx of these natural herbs in Zimbabwe. What advice would you give to someone who's just been diagnosed with cancer? They've been staged, the oncologist have told them which stage they're at, and they're supposed to start treatment. What advice would you give that person? The traditional medicine as opposed to we'll call which one is the traditional medicine here?
The traditional medicine is often the ones which are herbs and all this.
Yes,
yeah.
The traditional medicine.
Whilst we call them mainstream medicine, Western medicine.
Exactly, Western medicine.
Yeah. So truthfully, I'm a doctor, so I'm inclined to support what I know.
Yes.
And this is mainstream medicine, or otherwise called Western medicine. I would support that because we've got clinical trials that have been done on lots of women worldwide that have proven that most of these medications actually do well. And we also have women locally who've been treated and are doing well. Yes. And I know that as we speak, Rumbi, we know that we've got a patient
yes.
in common whom we know, and she is doing well.
Yes.
So for any woman out there who's just been diagnosed, my advice would be visit your nearest health center as quickly as possible and get help which is tried and tested. It might have some side effects, but most of these side effects will wear off after you're done.
Yes, so we're done with chemotherapy. I've done my chemotherapy. What is the next stage?
So in terms of treatment, some patients will get surgery, which is an operation. It can just be removal of the lump, the breast lump, or it can be a mastectomy, that is removal of the complete breast, with lymph node dissection, which is removal of some lymph nodes which are in the axilla. So this is just a general of the operations. And then some women will get the operation with chemo, some will get the operation and radiation as well. And most women in our country present a bit advanced, and often we need a combined treatment of chemo, surgery, and radiation. However, you also get women who present stage 4, very advanced cancer. And for these women, the cancer has spread to other organs. For example, it might have gone to the liver or to the lung or to the spine. You cannot then operate the breast and then go on and operate the liver and then operate the lung. You know, according to guidelines, that patient then requires chemotherapy after chemotherapy, and if they're doing well, they might actually just go on to hormonal therapy. And hormonal therapy is just tablets, most of it. They pop 1 or 2 tablets a day, and they are on it for at least 5 years. Some are on it indefinitely until either they've got problems with it, resistance, disease progression, or side effects which are not tolerable.
Okay, the difference between chemotherapy and radiation, what is the difference?
So chemotherapy refers to any treatment you get using chemicals.
Okay.
And normally with chemicals, we are looking at drugs. They can be given either as IV intravenous using a drip, or they are given as tablets oral. So chemotherapy, in the true sense of the word, refers to any chemical that is used to treat. But oncologists have stolen the word, and we sort of have taken it to refer to treatment using chemicals for cancer patients.
And then radiation.
Radiation is treatment using radio waves or radiation. So naturally, we've got a lot of radiation in the environment, from the sun, from the microwaves, from our cell phones. However, for treatment, we are saying we're using a specific type of radiation frequency and wavelength that has got the ability to kill cancer cells. And it is produced by a specific machine and sent into the body, and then it kills the cancer cells. It is painless, it is odorless, you can't see it, you can't touch it, you can't feel it.
So back to chemotherapy and radiation. Can a patient just go through radiation and be completely healed of cancer?
For breast cancer, no. So for breast cancer, they almost always need surgery, and then they might need radiation. Yeah, rarely do we use radiotherapy as the only modality of treatment.
We've gone through the treatments, we've gone through what the patient should do when they find out that they've got a lump. I want to know about support, the mental health. What is it that can be done by the people around the patient to support the patient mentally and physically?
So the most important thing is having a positive outlook and having a very positive, vibrant support system around the patient. This can be in the form of family members, which are very crucial, especially in our African setting. But for some people, it's friends, it can be church members, it can be workmates. So all these form an integral part of this patient support system. And what's important is that they should always encourage the patient, preferably with some knowledge. When you know that this is a side effect they are going to experience, for example, when the hair starts falling off, we wouldn't want the support members then becoming alarmist. Oh, your hair is falling off. No, they have to be understanding, very encouraging, and reassure the patient based on what they've also been told by the doctor, of course.
Talking about being alarmist, you know, when you're the support system, does the Cancer Health Center provide, for example, therapy or counseling for caregivers, for the support of the family? Because if they don't know that once you start saying, your hair is falling, if they don't know that that will cause mental issues with the patient, then they'll continue to do it. Is there somewhere, do you speak to patients and their caregivers and speak to the caregivers about how to handle patients?
So when a patient is diagnosed and they walk in for the first time and they're now seeing a cancer specialist, we go through the first consultation. But then soon after that, either a few days later or somewhere down the line, we have what's called a family conference. At this point, we say the patient will identify a few family members whom she or he feels are important in her care. And these particular people we sit down with. Usually I prefer to be there, but sometimes the nurses do that particular exercise. And they just allow the family or the support system to ask a few questions. At the same time, we tell them the things that we expect. So even when you're hurting inside, we then don't encourage the family to then go and then start crying all over the patient when the patient is still trying to deal with the issue. We then tell them that they also need care and they need to find help and to find another way of letting out their emotions amongst themselves. We are not encouraging people to hide, no, but we don't want to overwhelm our patient. So even when it comes to home care as well, every time the patient comes through, they are seen. When they are going home, we always say to the patient, don't come for visits alone. Come with somebody. So as you speak to the patient, we are very much aware that the caregivers are also listening and they're taking notes, be it about diet, be it about how to laugh at home, how to love our patient, how to support our patient.
Yes, so final words, doctor. What is it that you would like to tell Zimbabwe, Africa, the world about cancer, breast cancer awareness month? And what is it that you would encourage someone who's just being diagnosed of cancer?
Okay, so my last word to all the women out there, breast cancer is real. 1 in every 8 women might actually get breast cancer in their lifetime. However, it's not a death sentence. Early detection saves lives. But even if you are caught at an advanced stage, you can still survive with breast cancer. There is life after a cancer diagnosis.
That was Dr. P. Mba. Thank you very much. I'll see you next time.